Today we will be learning about the P-drug concept, and the definition of P-drug is personal drug selected for common diseases based on rational and evidence-based criteria. So, how did this concept origin? It was initially introduced by WHO uh, in order to guide physicians for good prescribing practices, and it helps us to promote rational use of drugs, and it is widely adopted in various education as well as primary healthcare, secondary and tertiary healthcare centers. And here we have a disease focused approach. P drug is chosen for a disease, not an individual patient, and other patient factors are also considered later during prescribing. So, what are the four different criteria for pre-drug selection? One is efficacy. Is the molecule really effective? And second one is the safety, to make sure the patient doesn't suffer any side effects. The benefit is more than the risk. And then, is it suitable for the patient? Is the dosage form, frequency, and will the patient be adherent to that therapy? And also, is the patient affordable cost? So these are the four criteria they will take into consideration whenever trying to put a drug, to label a drug as a P drug, or to include them in the formulary. So, how does WHO do the drug selection? They first identify what is the disease, and then they select the classes of drugs which can be used for that condition, and then they compare the classes of drugs according to the four criteria discussed before, and then they also look into the evidence of what is the data with these each classes of molecules, and then they will update it regularly. So, why is speed drug important? Why is having essential medicine list important? Because it helps to reduce the empirical therapy, and it also helps us to prevent polypharmacy and brand bias. It helps to ensure the safety of the patient, and it is useful in the resource limited settings. And it is also being widely integrated in pharmacology, uh, using problem based learning, role plays, and case studies. And then it also helps students think like prescribers. It is also adopted by the pharmacy students, PG trainees, and healthcare teams. So there is limited awareness among the clinicians and PG pharmacology students, and there is more need for awareness of how to choose a P drug, even be it for your own clinic or for the organization. And structured learning, a teaching process is needed for the same. So P drugs are continuously updated, and they reflect the new drugs, generics, and the updated guidelines. And this is a simple mnemonic which you can use to remember the P drug concept: personal drug, rational tool, efficacy, safety, cost, and regular updates, disease focused, and bedside integration. And it is included in most of the curriculum, and it uh, make sure the physician is responsible and makes responsible decisions for the patient, and it has clinical relevance, and it is essential for rational therapeutic practices. So what is the purpose of PDRUP? It is useful for rational prescribing, and it is disease based, and then we have the ESSC criteria, and it is originated from the WHO GGP, and it forms a core part of the medical or pharmacy training.